A reminder today of how dangerous the game of football can be. A study just released examined the brains of 202 former players at all levels, some in the NFL, some in college, others in high school and younger. But the results among those NFL players striking. All but one had a degenerative brain disease called chronic traumatic encephalopathy. I can see it, but I can't say it. Encephalopathy, and it's called CTE. This condition has been linked to repeated blows to the head. And for more now, I'm joined by Dr. Mitul Kapadia of UCSF Sports Concussion Program. Doctor, thank you so much for joining us. 111 brains of NFL players examined, and 110 had CTE. Are you surprised?
I think in some ways we've known about the risks in relationship of CTE in football. What the study has really helped us understand more. One is kind of the widespread the prevalence of this. We haven't had studies that have looked at this number of football players, specifically 202. Secondly is kind of the widespread across all types of football players playing all different positions, including ones that necessarily we didn't think have as high prevalence of head impact. And third is just the spread across all levels of competitive play, from high school to collegiate to professional level players. And we're seeing this these findings of CTE in kind of the athletes in all levels of play.
Yeah, you mentioned that. As I said, every position, and nearly 88% had CTE. Want to take a closer look now at those numbers. 48 of 53 college players, 9 of 14 semi-professional players, 7 of 8 Canadian Football League players, and 3 of 14 high school players. Now, CTE was not found in the brains of 2 who played football before high school. So given those results, the totality, what can you conclude?
So I think there's a couple of things to be aware of. One is that this has really given us a better understanding that the process that leads to these changes in the brain may not be necessarily the result of years or decades of play, because we're seeing some of these changes in younger athletes, including high school athletes. And when we're going to draw conclusions, it's always good to be aware of some of the limitations of these studies and other studies that have looked at CTE. Specifically, these brains were donated by family members that may likely have some concern about symptoms. And so we do have a limited scope of athletes. Secondly, we are really only looking at anecdotal cases of these studies. So we're not looking at a widespread group. Most of these athletes were playing football in the 1950s to 1990s. And so it doesn't necessarily reflect the current game, which has done a lot of changes. And the third, and kind of the biggest limitation, I think, and something that we're looking at a lot and from a scientific community, is that we don't have a direct correlation between the changes, specifically this collection of tau protein in the brain, which we call CTE, and the symptoms, specifically mood concerns and cognitive symptoms such as memory loss. There might be other changes in the brain related to playing football that could cause these symptoms. So there are some restrictions, but I think the biggest conclusion I would take away is that there certainly seems to be a widespread propensity for development of CTE in football, and any athlete that has symptoms, specifically concerns about memory or cognitive symptoms or mood concerns related to depression or anxiety, should be encouraged, whether they're current athletes or former athletes, to seek help sooner rather than later.
Yeah, as you pointed out, Doctor, obviously these donated brains, family members felt like there was a reason that their loved ones' brains needed to be looked at, most likely because of the symptoms that they exhibited while they were living. So how does this sort of translate to the general population?
That's really an excellent question, and I think that's kind of one of the golden questions in the clinical community and the research community regarding concussions. We don't have tools right now to be able to classify athletes having CTE or having a risk for CTE while they're currently playing or while they're even living right now. This is a pathological diagnosis of athletes that have been deceased, and then we're looking at the brains. And so it's really hard to make broader generalizations. I think there's a lot of research looking at specific types of high-resolution imaging, different types of blood markers that may give us some more indication, and specific types of testing, neuropsychological testing, that can help give us some information and an ability to stratify different athletes, both football athletes and non-football athletes, in terms of their risk for development of CTE, and give us some more information about how we can maybe treat different athletes differently based on that stratification.
Yeah, and as I heard the researchers say today, this obviously a very important study, but more studies, in fact, need to be done. Thanks so much, Doctor, for talking with us. Appreciate it. For our viewers at home, you can see more on the study's results right there on our homepage at KTVU.com.